Welcome to Health Exposure. I'm your host, Kurt Hill, and today we have a most interesting show. It's about metal, heavy metal. And as always, we have a very interesting individual here to talk to us, Deborah Arneson. Welcome, Deborah. How are you?
I'm great, Kurt.
It's always good to have you on the show.
It's great to be back.
This one, I'm almost tempted to tell everyone to grab pen and pencil, tape recorder, and everything else to really pay attention to the show. This, in fact, is a very serious topic. And let me just start off by asking you, what are heavy metals?
Heavy metals, Kurt, are body burdens. And in other words, when people become ill or sick, there's usually a presenting primary problem or reason for that illness taking place in the first place. And oftentimes they're much overlooked by the medical association. People don't really know what to look for with heavy metal burdens, but we're exposed to metals all the time in our food, in our environment, in our pesticides, and our sprays. And these metals are very problematic for people overall, especially when you see chronic problems, which I think we're going to get into.
In fact, it's so important. I took the liberty of taking a few notes, and let me just ask you this. How does one acquire heavy metal burdens?
Heavy metal burdens are found in people who are most particularly malnourished and compromised from a health standpoint. And what we're seeing more and more in America are individuals who eat very high percentages of carbohydrates, which are refined, and low percentages of good oils and, lean proteins and seeds and nuts and legumes and beans and things like that. Because of that, they end up compromised nutritionally. If you're compromised nutritionally, you're just a better host, so to speak, for parasites or heavy metals or funguses or infection or problems. So.
Wow. How does lack of sound health affect the body's reaction to heavy metals?
Well, when someone is compromised nutritionally, for starters, you'll see that infestations of these metals occur on a glandular level. They tend to come in, and metals like aluminum is a very prevalent metal, and we're seeing more and more of it in our environment, and we're seeing more and more of it deposited in the soft tissues in the body. For instance, you've, I'm sure, read a great deal about Alzheimer's and the correlation between aluminum metal burden in the body and deposits in the brain. When these metals go into the system, first of all, they create a barren environment. So you have aluminum in the brain, for instance, and you'll see that these people, pretty soon they have interference with what we call neurotransmitter function. So the body can't send off those neurochemicals, there's no receiver and there's no sender, and pretty soon you have like a short circuit in the brain because the metal is almost like a barrier. It gets in the way of the brain functioning or the neurochemicals in the brain from firing, so to speak. If in fact a metal like mercury is very common because so many people have old amalgams or fillings in their teeth, something like mercury will deposit in the soft glandular tissues like the thyroid or the parathyroid. So oftentimes, and we're seeing more and more people in my practice that have hypothyroid or they have hyperthyroid, and more often than not what you see is mercury toxicity or poisoning. It's very quiet, it's very insidious, people don't know to look for it, and it may be the primary presenting problem rather than the thyroid being the problem. It's not the thyroid at all. It's simply that the metal is present and it's getting in the way of the functioning of that organ or that gland. That's
scary. You go to your dentist and he says, just park your mercury in the thyroid. That's a little scary.
We're a very closed environment, and I like to tell people out there, our viewing audience, that think of your landscape, your internal landscape, as a landscape that looks like this, with lots of greenery and beautiful trees and little babbling brooks that are pure and blue and crystal clean flowing through them. Or picture this, an environment or a landscape inside of you that's toxic. Think of smokestacks with big, billowing black clouds, and a dump over here that has, rubbish and tin cans and a stream going through the dump that's all brown and toxic. Now what happens is a lot of people, more and more, because their environment is toxic and the foods they're putting into their body are compromised nutritionally, are creating a very toxic landscape internally. So the body is going, oh jeepers, I have to do this, this, and this, and this function, and there's nothing to draw from nutritionally because your landscape is so polluted. So what we try to do is teach people about what to look for, how to test for these things, and how to clean up their landscape.
Now where do these lodge in the body? Just
Well, all over the place, but particularly these heavy metals like our aluminum and our nickel and beryllium and titanium, These are metals that are found as bleaching agents or whitening agents in creams and lotions and powders, some of them. Things like cadmium are part of fillings typically, so is tin. When they put mercury in a tooth, they don't just put straight mercury, they put in tin, cadmium, and mercury together. It makes it a very stable compound and keeps it in there for 20 years.
That's appalling.
Well, you know, it worked, I mean, for a long time, and people didn't realize that there were correlations. And until hair tissue mineral tests became vogue as of 10 or 12 years ago, people didn't really know what to look for or why they weren't feeling good. But what happens, let's say, for instance, you've got mercury fillings and they start to leach, and that's what happens. When they go bad, they start to kind of dissolve into the bloodstream or go into the tissue. That's when you become toxic. Initially, they're bound in such a tight compound that they don't release initially. In very high doses to be problematic. The body can usually handle that. Again, as we get older, our capability for detoxifying the system becomes a little more compromised. You know, you have other burdens. Maybe you've abused with alcohol, you drink too much coffee, you know, you don't have enough fluid like water coming into the body, there's not enough fiber to pull out toxins. People eat dead foods without vitamin C or B vitamins, and those things like vitamin C and amino acids from protein bind the metals. They grab them and they pull them out the GI tract. Mm-hmm. So you just, you know, they go all over the place. I think your question was like, where do they go? For instance, you'll see nickel, for instance, which is found in margarine or hydrogenated oils. Nickel is a binding agent. It makes that oil stable, that hydrogen atom stable once they take out the saturated bonds. Nickel is a heavy metal. It deposits in the body, typically in the ovaries, in the uterus, in the pancreas, in the prostate, and it will in fact cause cyst fibers and tumor formations in the body.
My goodness.
Yeah, there's a direct correlation between that occurrence and heavy metals like nickel. Mm-hmm. And nickel, you know, I used margarine for years, and you know, from my standpoint, I had reoccurring cysts, fibroids, and tumors. I couldn't get rid of them. And the only thing, I was doing margarine for about 12 years. I finally got rid of the margarine, and the ones that came back were smaller. They weren't as aggressive. But I was still eating wheat thins, and wheat thins are very high in hydrogenated oil.
Hydrogenated oil, okay.
So the problem is, you know, how would you know that? Because you look at a label and you see, oh, hydrogenated soybean oil. It's got to be good for me because it's soybean oil. Mm-hmm. But people don't realize there's nickel in that processing, that manufacturing of that hydrogenated oil. And the nickel is the compromising factor, because then what the nickel will do is it will land in the ovaries or the uterus or wherever these soft glandular organs or this tissue, and what will happen then is it just kind of makes the whole landscape of that organ somewhat barren. It compromises that organ nutritionally. That makes that organ or that glandular a perfect host for things like parasites and amoebas and worms. And we're exposed to those in our diet every single day. I mean, you know, you go to the corner, you know, fast food place and some kid wipes his nose and he handles your burger or something, and he's passing on bacterias.
You said burger, right? Oh, okay, just nose burger.
Yes.
Yes, okay,
or it could be
you.
your salad. You
oh,
know
my
what
salad,
I'm saying?
okay.
I mean, maybe somebody scratches their face and they have acne, or they have a boil or something, and they don't wash their hands properly. I mean, so many of us eat out that we're exposed to a lot of toxins in our environment, a lot of bacteria and parasites and things like that, and they come naturally in a lot of our meats. So
I know
hopefully,
who to give my margarine to. If he ever touches his nose when he's dealing with my burger.
That's it. He's
I'm trying to think of a way to segue into something that I get an awful lot of times in my practice. People ask this question, and I really don't know. So what is the relationship between heavy metals and tumors, fibroids, and cysts?
That relationship is exactly what we were just discussing. Simply that if you have a heavy metal present in the body, let's say in the lung, you know, people will end up with heavy metals here that deposit in the lung area or in the thyroid. Those areas, those glandulars, become basically barren, and they don't have enough good, hardy bacterias or the immune strength to fight off parasites or bacteria or worms that invade. And typically, cysts, fibroids, and tumors tend to be colonies of worms that kind of hook together. They colonize. And they all kind of migrate to the same area because they have a perfect host to live off of, be it your ovary, you know, be it your uterus, be it your lung, be it your thyroid. So they hook together, and that's the beginning of a formation of a tumor or a cyst. And what happens when you start to have something like that forming in the body, all these little guys all come together and create little balls. They can be this big. the body will begin to overproduce calcium and magnesium in an effort to contain that growth. So you end up with this hardened area, say on the breast. And the hardened area basically are these colonies of worms which are laying their little larvae inside the calcium and the magnesium, and that's beginning to grow and grow. And the calcium and magnesium is being released in greater and greater concentrations to keep it more encapsulated. So you have a little cyst or fibroid, wherever it may be, that's beginning to get larger and larger. And it's often diagnosed as cancer. And oftentimes it's erroneous. It's basically a little colony of worms or parasites that have been encapsulated in almost like a crystallized calcium.
That's incredulous. Now,
Yeah, it's
how
very
do
interesting.
the individual listening to this particular show, and we encourage people to do breast examinations on an ongoing basis. Is there any way you can tell the difference between a cancerous lump and something that deals with parasites? Or?
Well, you know, I couldn't really tell you. There are different tests that you can certainly do, and more often than not, the medical profession will draw, you know, do kind of an invasive procedure where they actually take some fluid out of the cyst to see whether or not it's cancerous. But from what I understand, for the most part, if it's a nodule and it's movable,
yes,
it's not problematic. Once it becomes very hardened and stiff and very calcified, then it becomes problematic. And it's most often diagnosed as cancer. However, the best thing to do is to find out what your heavy metal body burdens are, get those out of the body, find out whether or not you have parasites, worms, or amoebas, and get those out of the body and see if in fact it doesn't begin to reduce in size and go away. How about it?
I have another question for
Sure.
you. You never cease to amaze me. Just when I think,
Oh, you're so nice.
just when I think I know something, you come on the show and you say, no, it's not this, it's this. And by the way, we can extrapolate by going into this and explaining this. And it's so important because we as consumers don't even I had no idea that we had metals in our foods. I thought you were going to tell us from using pots and pans and things of that sort. But
Well, it can be from using pots and pans. I'll give you, for instance, I just saw a young man that I've been working with on and off for about 2 years, and he had heavy, heavy metals of mercury, aluminum, and lead. So I sent him out to a practitioner in the suburbs to do chelation therapy.
okay.
And chelation therapy is whereby they use things like calcium and magnesium and vitamin C to actually chelate or bind to the metals, pull them out of the system through the kidneys, the skin, and the GI tract. And he did the chelation therapy for about 4 months. We retested him, and he actually brought his very high levels of things like calcium, which were too high, and magnesium, which was too high, down. He brought his copper down, which was very good because his copper was very, very high. And he brought down his lead and his mercury by about 2/3. His aluminum, in fact, went up. So we were discussing this, and I said, you know, I'm not real clear why your aluminum hasn't gone down. Are you doing anything that would be encouraging for aluminum to deposit or redeposit in the system? He goes, well, you won't believe it. Because you had me doing so much protein, because amino acids bind, like methionine, cysteine, and cysteine, actually bind onto our heavy metals. He said, I was taking my food sources primarily from cans, aluminum cans. So he was eating tuna in a can, and salmon in a can, and chicken in a can, and turkey in a can. I was like, why? You know, and he was like, well, I just didn't think of it till it was too late.
Because he can.
Right, because he can. Right. Why do people do what they do?
Are high concentrations of calcium or, for example, copper considered body burdens?
Absolutely. I wish I would have brought a graph for you, but picture this. There's what we call like a 50th percentile. Here's 0, here's 100. At the 50th percentile, that is where you want all of your minerals to be balanced. You've got calcium, magnesium, phosphorus, iron, zinc, chromium, you know, selenium. I mean, the list goes on and on and on. These are what we call minerals. When minerals become exorbitantly high in the body, they begin to cause burdens on the body as well. If you've got too much of calcium, you can be darn sure you're going to have too little of zinc or too little of selenium, because calcium is a bully. It's a very heavy, dense mineral. If you're taking calcium all the time and you're not utilizing it well, because there may not be enough magnesium present in your diet, then it will actually get into the cells and it will block the utilization of your other minerals, and they become compromised. So you may see someone who has terrible dermatitis and in fact they have a zinc deficiency. You may see someone who cannot regulate their blood sugar well because they have no chromium. You see people with sleep disturbances because they have absolutely no lithium in the system whatsoever. Now, you don't want a lot of certain minerals, but you want enough. You know, you don't want too much and you don't want too little. I mean, the body, Kurt, is all about balancing. It's about homeostasis. You don't want too much or too little of anything. And if you have too much or too little of anything, what will occur is probably the same symptom. So if you have too much calcium, you'll have hair loss. You know, I have women who come in and go, my hair is falling out, I'm going bald. I'm like, ooh, not a good thing. Let's look at your hair tissue mineral analysis, and you'll see that their calcium is 300 and something, and it should be about 57.
That's incredible.
Then you'll bring their calcium down, and they'll be fine. Hair stops falling out. Or conversely, I'll have a woman come in, and she has like 2 on her calcium score, and it should be 57, and her hair is falling out.
And that's not as rare as our audience may think, because I get that often in my practice. It's very common. Women will mention that they're going bald, and they'll laugh and say, oh, maybe it's just this or that. But I'm glad you mentioned that. That's good.
And it is good to mention this to our viewing audience, because what we're finding is women are supplementing with a lot of calcium. They're missing all their other supplementation of minerals, which is not a good thing. And when you have too much calcium coming in, you're creating more problems for the system. Now, when you imbalance yourself like that, or you create an imbalance with too much of one mineral, not another, when you have exposure to things like aluminum or to nickel or to lead, which is in our water supply, then in fact what will happen is those heavy body burdens will begin to creep and grow. And that, in fact, will compromise your other minerals even more. So if there's too much of a bad guy there's not enough room for the good guys to do their job. So they just kind of get disposed of. But honestly, Kurt, for the most part, people don't have enough minerals in their diet, period.
I know you're going to probably tell us that you have a way to determine how many minerals are in the diet. Is something about a hair analysis, hair tissue analysis or something?
Right. It's called hair tissue mineral analysis. And it simply means that I'd have to take the front of your hair there. No.
Front of my hair. Okay.
You actually take a hair sample from the nape of the neck, and the sample would entail taking about, maybe just a palm full of hair, but it has to be enough to run an assay or an analysis on about 60 minerals, including the toxic metals. And what this does is it shows you correlations between chronic health problems or diseases, or your propensity towards those diseases. You know, if you continue with too much of a burden of aluminum on the system or very high copper. I mean, one of the things I'm seeing a lot of too, especially in men, is high copper. And copper causes dermatitis, depression, hair loss, insomnia. It has many manifestations of ill health.
Where would they get copper from?
You can get it from your water pipes now, because the entire city switched over to copper piping about 12 years ago. So all the new high-rises and whatnot are all copper lined.
You got kids wiping their nose and touching your burger. You got the city with the copper. I'm not eating. That's it. I'm with the kid with the can.
Help, I'm out of here. Right. You know, it's funny because a couple years ago I took a food sanitation course, and by the time I left that course, I was like, no, I'm never eating in another restaurant. And I went home, Kurt, and I completely threw out everything in my refrigerator. You know how you keep like that can of whatever, or that jar of dressing for like 4 years just because somebody might like it when they come over for dinner.
And you know, see, what my daughter doesn't realize is I was trying to save her life because of the fact that I never kept anything in my house, and she was complaining. Just wait till she sees this show, I'll tell you. I have another question. What does this involve on the part of the patient?
Well, you mean to take a hair tissue mineral analysis?
Yes.
You know, they would have to find a health professional such as myself who does hair tissue mineral analysis. Many chiropractors do it. Nutritionists typically will test for this. Many doctors on both the East and the West Coast, not so many here in Chicago. It's been around for years, and it's a pretty good test to do. I mean, I find it very accurate and extraordinarily helpful. What this particular test will show you is exactly what you're missing, what you have too much of, and what your heavy toxic metal burdens are. So if in fact your metal burdens are exorbitantly high, you know, on a ratio of like 1 to 100, you have to start getting those metals out. And you do that by consuming specific nutrients. Things like sulfur, which is found in garlic, is very good for removing heavy metals. Vitamin C is excellent. I mean, people who have really toxic heavy metal burdens need to do between 3,000 and 4,000 milligrams of vitamin C a day. Free-form amino acids are very important because metals will deposit in the joints. A lot of times, you know, you're creaky or you hear this when you move around. I stopped drinking Chicago tap water about 15 years ago, and my hips and my knees stopped snapping. It was amazing. Now, I still have pretty high concentrations of aluminum, as I just tested myself about 6 months ago. So I need to work on getting my aluminum out. And oftentimes, and I need to tell our viewing audience this as well, you can become really fatigued or tired or kind of toxic when you move metals out of the system. So it's important that you do it right. You just don't want to go figure out what you have wrong and read all the books on how to get it out. You've got to make sure that you've got the binding agents to pull it out of the body. So I equate removing heavy metals to this visualization. Follow me. Okay, there's like this little guy, he's like a sumo wrestler. He's our protein. He goes in, little fat pudgy guy, and he goes, hey, heavy metal, I got you. You know, boom, he's taking him, kicking and screaming back over to the liver. So this metal wants to stay put. He's real happy wherever he is. He takes him back to the liver, and the liver's like, what do we have here? Now you have to have this little, like, you know, scooper, like a Pac-Man who takes him and goes, get him out of here. So that would be B6 phosphate. B6B5 phosphate is very good for removing the metals out of the liver. And then after that, you have to make sure that you have ample water and fiber to move the metals through the GI tract so they don't become recycled into the body again. Because you can move them all the way down to the liver. If they don't get out of the liver, they're going to be reprocessed and redeposited. So it's a process, and it takes a minimum, I'd say, of 3 months to 6 months to get your metals out. If you're very diligent, you can do it in 3. I just did this test on a little boy who is so toxic. He has terrible muscular problems, you know, can't walk, and just developed a lot of heavy metal burdens. So we tested him. He was packed with everything. I was like, how does a little 1.5-year-old boy become so compromised? And we started working on his burdens. In the second year we tested him, they came down a little bit more. Now we retested him again, we got rid of everything. Also at the same time though, because we were chelating all of his metals, we took out a lot of his good minerals as well. It's like, we got them all out. So now we have to resupply his body with plenty of the good minerals so that the muscles can start developing. And they are, so.
Well, that's incredible. That's incredible. Well, I'm glad you mentioned the sumo wrestler, because for those people who think they have indigestion, they now know they have a sumo wrestler walking around their stomach area.
You know, Kurt, I'll just say one thing. You know, many people, we do blood tests, you know, at my clinic and whatnot, but the hair analysis is probably one of my best tools for people who have problems with indigestion and people who don't, you know, have enough enzymes, because metals will actually compromise your ability to utilize and create enzymatic activity in the gut or the stomach. The first step in digestion into creating wellness in the system is to have a stomach that works well. That means you have to chew well. Most of us don't. Most of us are like, where'd that go? I am guilty. I mean, I can do that as well. But you have to chew well. And, you know, if you smell food and you prepare it and you cook it, it gives your salivary glands time, your glands time to start dropping this chyme into the stomach. The stomach creates the enzymes. The enzymes signal to the liver there's food coming. The liver signals to the thyroid to get involved. The thyroid signals to the pancreas to start cranking out some insulin. And that takes 12 to 16 minutes.
My goodness.
Well, I can eat a 3-course meal in 7. I worked in the wait staff industry for so long, you become very, very conditioned to eating quickly. The problem with that is if you don't digest well, you can't get rid of anything. You can't use the vitamin C in your apple or your orange. You know, you can't use the amino acids in your protein food. So you have to make sure the stomach is working and the enzymes are present. So the hair analysis gives you an overview, a good picture of whether or not you need enzymatic support. There are lots of enzymes in the world. Your body produces over 300 plus.
My goodness.
You know, the mother of all enzymes, of course, you know, is your proteases for protein, your lipases for fats, your cellulases for fiber, and your amylases for carbohydrates. Then you need pepsin, betaine, hydrochloric acid. So you need lots of good enzymatic support in the gut. If you don't have that, you won't get rid of your metals, and you need to know whether or not you need the help. So this test shows that as well.
That's really
it's a very good test. You should do one.
I think I'm going to have to.
Yeah,
but first I have to learn to chew, which means I have to go and get the teeth.
First of all, it means you have to take time to eat.
Take time to eat. That's right. That's right. That's absolutely right.
So it's a valuable test. It's very valuable.
What diseases are most often correlated with heavy metal toxicity?
Oh, that's a good question. Joint problems are always a problem. More often than not, what you see are people who have pretty much arthritis, and that would be burdens in the different joints of the body, and thyroid. Thyroid's very common. Hypothyroid is associated with mercury in the thyroid. people who have lung problems, and as you know, lung cancer is the #1 killer in America for
Yes.
cancers.
Yes.
And more often than not, things like nickel and mercury and aluminum and cadmium will deposit in lung tissue. So you want to make sure that you keep the lungs really cleared out, because we're breathing pretty toxic air these days. America has some good pollution going here.
We really do. And the problems we never would imagine when we think that we have a good diet and in good health and in a very clean environment. We're surrounded by things that could exacerbate our health situation.
Right.
And it's just incredible.
Well, it's a real polluted environment. We have created, man has created this real noxious, toxic environment, and we're all subjected to living in it. So the survival of the fittest will be the person who can handle environmentally, internally, what it takes to survive.
Mm-hmm.
So,
Deborah, how often should a person get a hair analysis? Should they come back? You give them all this good information. How long does it last? And
I would say initially, if you say you test today, you should test again within 6 months, providing you follow the protocol that is suggested by the lab that gives you the report, or the nutritionist or the doctor that you're working with. And then you can test maybe once every 2 or 3 years, but as long as you're aware of where your metals come from and how to contain those, being infused into the system, you'll be on top of it. And I always tell people, if you have energy and you feel good, that's a sign that everything's working pretty well.
oh, that's great.
So,
That's great.
just kind of follow your body's signals. If something's starting to give out, then you're in trouble. And energy doesn't leave people just one day, Kurt, or overnight. You're compromised for a good 5 years before you start to lose energy.
I see. Wow. Deborah, I could sit here and ask you 1,001 other questions.
Go for it.
But I'm getting signals that we're running out of time. And I want to ask you, if you had to sum up and tell us anything before you leave, what would that be? I mean, what would you want to leave us with? What thought?
I would say, do yourself a favor, even over a blood test, get a hair tissue mineral analysis done, and take a look at your heavy metal burdens and find out what minerals you're missing, because the minerals are the key to life. They're the best thing that you could possibly infuse into the system for enzyme formation.
Not only for our viewing audience, but for me personally, I want to say thank you for
Thanks
you coming
for
by
having
the
me,
show
Kurt.
and filling us in on so many things. It's always, we leave here knowing so much, and at least realizing that we should pay attention to our diet, our nutrition, our food, our
and
quality.
our heavy metals.
And our heavy metals,
Right.
That's right. It's not just a rock group.
Right.
So until next time, I'll have to say goodbye and thank you for joining us with Health Exposure.